So let's start. See, today we are specifically going to discuss about second years, but I think it will begin with a bit of a disclaimer. And see, whatever we are discussing here is just for the residency part. So because the amount of topic that we are going to study in our residency will be a part of it, and the later half of our journey, that is during our senior residency or when we are doing independent consultation, or if you are doing DM or PDF, kind of learning happens there also. So yeah, that is why I have written it that this is just the tip of iceberg. Always remember, sky is the limit. And as you all know, psychiatry is an evolving branch. It has not yet like the whole thing hasn't come yet. It is in the process. So yeah, new things will come, and according to your interest, you can definitely pursue them in coming future. So there are some harsh or raw truth that I'll be talking about residency. See, people say they have this notion that psychiatry residency is chill, easy. Okay, you just have to sit. You don't have to roam here and there. You won't be busy dealing with patients as your colleague will be doing if they are in a different branch, be it in medicine, surgery, peds, ortho. But always remember that while dealing with patients, uh, physical exhaustion is something which is not that evident, but mental exhaustion is very, very evident. Okay, it happens to all of us at times, and sometimes it is much more that uh, we might need a bit of rest. And it is a very skill oriented branch. If you lack the skill, you will definitely not end up doing well. You have to spend more time on yourself so that that amount of skill definitely gets better. See, there are some other branches in which if you know a bit of basics, you are good to go. But in psychiatry, if someone says that they just want to know the treatment protocol and the guideline, that doesn't work in the real world. Okay, you have to know a bit more in a much more skilled manner. Skilled manner means in a very detailed manner. You have to know a bit. Some part of it definitely you should know. Otherwise, what will happen? You won't be able to do the justice to your patients, neither to yourself, because at the end of the day, you should be happy. If you're not happy at all while doing your work, I think that is the biggest injustice that you'll be doing to yourself. Okay, if you have chosen this branch, I always say that uh, there are two kind of people. They choose psychiatry because they were not getting anything else, and there are people who are being chosen by psychiatry. Okay, so to learn the skills, be it interview skills, be it giving depot also, be it giving the writing the prescriptions, everything does matter a lot. Be it in your own clinics, if you're working for any institution, develop that kind of skill so that your patient set is totally different. Don't forget this. Okay, your patient set, your attendance, the patient's attendance, the kind of difficulty you have to deal with, these all are pretty much different as compared to your colleagues who are in different branches of medicine. Okay, that is why you need to have that skill of convincing people, specifically the patients, skill of looking into their problems, what is the problems that is causing hindrance in the treatment, because everything would be the same for each patient. So yeah, you have to know. That is why I've written this part, that it is a very skill oriented branch. You can't just come in and go out without uh, investing time sharpening your, already if you're having something inside you, you have to sharpen it up. You have to literally polish yourself so that at the end you can definitely be a help to these patients. Okay, and yeah, the learning is always by Moodle in your jarship. This is your jarship. You will learn a bit, but when you come to your senior residency, you will learn another set. And always remember why this gap is there. Specifically, I have chosen this curve because what you are going to learn over here, what you're going to learn over here, that same won't be repeated here. So it is a bit of difference. Some part will definitely overlap, but remember, whatever you are learning in your residency, it won't get replicated in your senior residency. Definitely, you can read the same stuff again and again. But what will happen is like then you won't be doing justice to your senior residency. Okay. So senior residency is also a learning period in psychiatry in every branch. But junior residency is something which should actually be carried out with a bit of seriousness. Okay. The amount of learning you have while you are a JR, that is way, way, way much more as compared to when you are an SR, because the responsibility comes in when you are an SR. Okay. And yeah, this is a myth, true myth. Work life balance, it is there after residency, it is there only after your residency. It has never been a easy walk if someone is there in psychiatry. So yeah, don't expect that you have a fair work life balance. If you are choosing psychiatry, if you have chosen psychiatry because of this, you all must have now uh, realized that it is nothing to be of it is nothing what people used to say, that it is pretty chill, pretty, less hectic. It's nothing like that. One patient, it takes enough time. So yeah, and this should be one of the key things. Either you read it through paper pencil method or digital method, but reading should be done daily. And daily means not 3 4 hours, 5 hours, because you don't get that time. You only get that time for only your if you are in your DRP posting, if you are in a very light kind of posting, or when you're having your weekdays, sorry, the weekends. Daily, even if you get half an hour also, no, that is more than sufficient. Not more than that. I am not at all expecting that if you get more than even if you get half an hour, that is more than sufficient. You have to, yeah, Manisha, please mute yourself. Okay, this is the minimum that you have to invest. You have your leisure time also, you have your private things also, you have your personal thing also, you can deal with them, no issues. These are part of life, don't be ashamed. Okay, if you're having a partner, if you're having someone with whom you are in a relationship with, if you're having some other kind of thing, like if you want to ride a bicycle, if you have some kind of s- uh, you know mm, like if you like to play some kind of sports, if you like to do some kind of novel reading, anything like that, it's your choice. But as far as residency is concerned, do give half an hour daily. If not possible, if you're on a duty day or a hectic day, it's okay. But daily, try to read at least half an hour. Now, see, this is something which creeps up very, very fast. So you have to be patient. Always, always be patient, because skills in psychiatry comes very slowly, and it's time taking. How you handle your patients, you'll learn gradually. Don't worry if your senior or if your colleague or if your senior resident or your faculty is able to deal with the patient in a much more calm and an easy manner as compared to you, because they have been in this branch for a pretty long period of time as compared to what you are. So please be patient about this. You will learn. You will also reach to their level or even will surpass them. No issue. And don't change yourself. I say this because, see, you are a very different human being. You are all different. Don't change it for someone else. Rather improve on what is there, what are your shortcomings. If you are too judgmental, change it. If you are actually too impatient, change it. But don't change as a person. Your perspective, your vision should definitely be the same. Okay, if you are there to help the patient, find more avenues by which you can help the patient. If you are here to learn something, if you are here to learn how brain functions, find more avenues or the better way by which you can explore it. So don't change it just because someone else's vision is something different. Because people in psychiatry, I'm very open and very vocal about this, and I don't have any shame in saying that people are they here to shape others view. Rather than shaping their view, you should help the other residents to grow. That is not the goal. Uh, if you help them to achieve what they want, that was the best way out. Okay, learning is a good thing, but I shouldn't mold you up in a particular manner that you have to follow what I'm saying or follow me. You have to have your own vision, try to build upon it, take help from your seniors, take help from anyone, be it your junior or colleague, so that you can fulfill your vision. That should be the goal. You should be a better individual after 3 years of residency. If you're not a better individual, you cannot be a good psychiatrist. This is very, very true. If you're too greedy, you can't be a good psychiatrist. If you're too much into a very, you know, if you're too delay in making decisions, you can't be a good psychiatrist. You have to be an overall balanced individual, and that comes with time. So open yourself up to learning. Don't run from anything. Don't at all avoid uh, taking part in discussions, attending anything, be it your seminar, CC, JC, award rounds. If someone or someone's like of your faculty or SR or your senior colleague, they say something, it's okay. Try to learn something out of it. At times it get overwhelmed, I know, but yes, try to find every single piece that can be helpful for you. Okay, otherwise what will happen, you won't be able to uh, you know if you try to run, you won't be able to acquire those skills. Okay, fine. And yeah, don't make fun of them. They are what actually makes you learn, and don't be judgmental towards them. Fine. Be it a patient of borderline personality, that's also fine. You don't have to judge them, because by judging them, you won't be doing any help. Rather than that, you can do a supportive psychotherapy session with them, which can help them to pass with the current ongoing crisis. Okay. So try to develop these skills. These skills actually matter a lot when you pass out from your institution. Your institution is a very safe haven. Okay. So nobody will say anything to you, like if you are there in your institution. The moment you are out of your institution, everyone will be you will be responsible for whatever you do, be it your prescriptions, your therapy, your way of dealing patients. It will be all reflected upon you. So yeah, this is what you're working for. If you're working for patients, if you're working to learn, you have to be non-judgmental. Okay, and this is something very important, observation skill. Not only it will help you out to write your MSc or to elicit psychopathology, but at times these subtle signs will help you to make your diagnosis too. Okay, so be observant. Try to observe patient. Look into their eyes wherever you talk to them. Try to be humble, but yeah, observe everything about your patient. This is something which you should do, else you won't be able to study, you won't be able to relax. In initial days, it is very difficult. Like if you are in your ward, excuse me, the same kind of yeah, excuse me. The same thing will keep on going in your mind when you are in your ward. You'll keep on talking about your patient, what they have said, what has happened in your ward, what is going on. Okay, the kind of gossip, everything will be continued. But try to keep it restricted to your wards only. After you're out of your ward, do discuss other stuff. You have so many things to do. Okay, like if you're interested in politics, games, the any kind of scientific advances, any kind of movies, songs, whatever be it is, try to talk about those things also, because not everything is there inside your ward. It is just a part of your life. Don't make it your life. Okay, there should be a balance. And as I have said, that it takes time. So yes, give time to yourself. Then only you can actually, even after passing your residency, you'll be able to make that work life balance. So try to leave your work in the ward. Once they are done, wrap up your things, go out of the ward, and there is other things to do also. If you are fine, if you're able to do it, very good. If you're not able to do it, this part, start working on it. Okay, don't keep on gossiping the same thing. Don't be stuck in your word. If you keep doing that, what will happen? Your mind won't be able to relax once you're out of the word. So please stop doing this. Important thing, important stuff while you're reading, that is okay. But don't keep on discussing the same stuff again and again. And in some time or the while after a month or a two or every 45 days, take a break of a day or two if possible. Relax, give time to yourself. If you find that you can relax while traveling, you can travel for a day or two. If you find that it's good, that you will close your door, listen to music, watch movies, uh, do any kind of sports, read novel, do give time. Because if you don't do it, you will be exhausted. Because again, this is what it is, very exhaustive branch. Mentally, it is very exhaustive. Fine. Now, let's look into the hierarchy, how we should proceed. See, many of you were in your first years and now has they have you all have been into your second years. So what will happen is, like, initially when you are in your first year, all the menial works of the ward, everything has to be taken care by you. So there only the clinical work part was taken care. Whatever cases you have to do, you will be doing it. Also taking the work of your seniors and your colleagues. Now onwards also, even if you are in your first year, this is something which you can't miss on. If clinical work is something which you are not able to complete, devote time to this. These things can be taken care later on. Don't have to worry about these things. Okay, this is something which you shouldn't miss on upon the clinical work. If your clinical work is not, it's suffering, you're not able to perform nicely in your clinics, I think you should devote all of your time to this. Once you are done with this, then only you can move to other part. So clinical work in your OPD, in your ward, in your follow-ups, always should be proactive. Okay, always should be proactive. Take the history, learn. Everything should be done in your ward and OPD. Don't feel that it is the same old stuff that is going on and on. You'll try to find that you'll be able to find every patient is different. There are various other ways by which you can help them out. So, taking history, taking your follow ups, whatever patient comes back to the OPD or the ward, try to do the best. Okay. Once you are done, you have something very big. Without this, you can't pass your MD. That is your thesis. So, once you have submitted your protocol, keep this in your mind. Keep a separate diary, a diary for thesis. Most of you have to submit your thesis by the end of second year. In my institution, you have to submit it by the fifth semester. So I had a pretty fair amount of time as compared to you all. But I used to keep this diary in which I used to divide that for the next 6 months, I'll be taking the sample. My sample was 150 samples. So I divided it according to 6 months. I can't collect 150 sample in one day. So I know that 6 months is something that I have to devote so that my samples get collected. Okay, fine. That is the maximum that I can give, or maximum you can give is up to 8 months, not more than that. Because after that, for 4 months, you have to do the analysis, write it, and submit it. So you have a year with you, and you can actually divide it that you will be giving 8 months to your sample collection and last 4 months for analysis and writing. One more thing, while doing thesis, keep a copy of your protocol with you. Always keep a copy of your protocol. and get all the printout forms beforehand. Any day you might need to keep 5 to 10 forms that you have to get filled by the patient. Okay, so many of us will be having samples somewhere ranging from 100 to 200. Okay, if you are having more than 200, you have to be a bit more, a bit more concerned regarding this. But if you're having like anywhere around 100 to 200, you can easily do in a period of 6 months. Now, if you divide this 6 months into 150, you can easily see that on a single month, you need to correct around 20 sample, and that can be easily done. Okay, some days you might not get any sample, so 8 months is the maximum. You can always have to think about 6 months, that every day one sample or two, one or two sample, or at the end of the week you should be able to collect around 8 to 9 sample. That is what should be the goal. Okay, if somewhere sometime you get more, good for you. If somewhere sometime less, don't be in a panic. You already have 2 extra month with you so that you can complete it. But always carry a form, around 5 forms, and a copy of your protocol. If any doubt happens, clear it on that day only. Don't ever miss it, because at the last what will happen, no one will listen to you whether you have done a mistake while applying a scale or the way you have collected things. So always keep a copy of your protocol digitally, or a physical copy, or a print copy, hard copy, so that you don't miss upon it. Once you are doing this protocol kind of this sample collection kind of thing, your mind will be at ease. Your brain will stop thinking more about it, because what will happen, you are continuously progressing. So a separate diary for thesis, a printed copy of your protocol or a digital copy, and at least 5 to 6 forms daily you have to keep it and carry. Whenever you get a chance, get it filled. See, if you're doing things honestly, why not to do your thesis honestly and on time? Why to get scolding, or have this kind of fear in your mind that, oh my god, I'm not able to do my thesis, what will happen? Because in second year, first year, you are already preoccupied with your work that is given by your seniors or by your colleague or by the department. Now second year is, it gets ruined because of this. This ruins, because most of your time this is something that is going on in your brain, on and on, like how you have to complete the thesis. But if you start from now onwards, February is the time, and you have till December. If you start today also, you'll be able to do it well within the time frame. Okay, so thesis should be one of the things that should be there, right on your top priority list. For that, you have to carry something with you. Carry a diary, make a note of the patient that you have taken the detail, just the name and the serial number that you are filling the form. That's it. So there, at the end, you have an easy tally. 100 patients, 100 list, done, over. Keep the forms, do the analysis, fine. So just three prerequisite: a diary, form, and a printed copy of your protocol. And start early. 8 months, it's good enough time. You can easily do it. Once you're doing your thesis, once you're done with that, now you have something which is called a self study. Now, even though I have written 1 to 2 hours, that is the maximum that you can do. Okay, or if you can do something more than that, that is also fine. But 1 to 2 hours should be done. If not, half an hour of self study is also important. What you can do is, like, you can select either of the things: textbook, articles, presentation. Okay, you can look at any of these things. Try to read it full. If not possible on a day, do it on the second day. And then whatever we have discussed about relaxation, that comes at the end, but it is an important part in this hierarchy. Don't miss on this also. If you have some days free, do try to relax. Go to movies, travel. Sorry, I'm not well. Cook if you want. Read some books that you want, but do relax. Okay. Now, I have see why I have included this picture, because everything might seem to go very well in second year at times. Okay. You are doing your clinics, your thesis, but one time it might come that you are again at, you know, something or the other kind of presentation will come, thesis submission date, or like midterm will come. You will be involved in some kind of activities that is going on in your college and institute. So these things will definitely come. But again, what will happen is after this phase is done, you will again have a straight road, a stretch of straight road. So utilize these kind of straight roads. Hairpins will definitely come, but there are some period of time when there is no chaos that is going around. Utilize your DRPs if you're going in your second year very well. Okay, do lot of fun, enjoy, but a part of it should be utilized for your studies. Now let's start with the important part. See, if you don't have these two things, I think it's high time you should have it. You won't get ICD 11 as the printed form. Okay, you won't get it because it is not available in the printed form. So I got myself a printed copy of it. I took the PDF and have got a printed copy of it. So this is there with me, my ICD 11. Similarly, I have ICD 10 also, DSM 5, DSM 5 TR. So get an ICD 11 and DSM 5. You can get it from any source. ICD 11 is in the PDF form. If you like the PDF form, good. If you don't like the PDF form, you can get it printed also. Now, you should follow the rubric headings. Like, for example, schizophrenia and other psychotic disorder. This is the heading. You should know this heading, know important codes inside it. Okay. Like, always know that point 0.8 and point 0.9 is for others and NOS. This is the category that they are talking about. Okay, you should know some like some of the disorders you can't forget the codes that I have mentioned over here. If you don't know for gender dysphoria, it's okay, but you can't miss on schizophrenia, depression, BPD, OCD, anxiety, somatic symptom, or stress related disorder. You can either, what you can do is, you can make a sticky note. Today itself, you do it, stick it right on your table, or if you carry a notebook or a diary, please write the ICD 10 and ICD 11 codes: 1, 2, 3, 4, 5, 6, and 7. Only 7. For child psychiatry, always prefer DSM 5 or DSM 5 TR. Almost it is the same than ICD 10 or ICD 11. Much more well planned way it has been given in DSM 5 and 5 TR. Okay. Now, the only difference that I want you to focus is focus on duration, which is very different in DSM as compared to ICD. So this should be something which you should focus on. Now, as I've said that for child psychiatry, you should read DSM 5 or DSM 5 TR. Fine. Definitely go and give a read before reading any disorder. Before reading any disorder, why I've said this is a talisman, because you have to tie it before you start your battle. Okay. Before reading any disorder, read ICD 11 and DSM 5. Nobody will tell you this because nobody has actually practiced this part. What I have been told and what my friends have been told regarding this, it has really helped us. So, if you read, for example, psychosis or schizophrenia from ICD, you will get an wholesome idea what ICD covers, what DSM covers. So you'll get that there are brief psychotic episodes or disorder is there, or ATPD part is there, schizophrenia proper is there, psychosis NOS is there, substance induced part is there. So you'll get an overview. While reading also the textbook, you will have this thing in your mind that okay, these are the various things that are given in ICD. I need to find those things also in the textbook. So kind of, you know, you are making your basement, you are making your base, building upon it. You have already found laid the foundation with the help of these ICD and DSM. Now you are building upon it by reading various sources. As a resident, you should know these things, ICD 11 and 5. Before reading any disorder, read them so that when you're reading your particular disorder, you won't feel very alien kind of thing. Okay, I have read it there in the ICD. This is there. I need to understand. And this is one of the important key feature that is diagnostically important. So it has been mentioned in ICD 10 or ICD 11. That is why we have to read it. Okay. So always keep this thing in mind. Keep a hard copy or keep a digital copy, but you should know this. These should be there in your table as a sticky note or in your mobile phone as a digital note, anything, but you should know them. You can't miss. While you're having your Viva, no, they'll ask this simple thing that what was the ICD 10 code for OCD. You will be stuck at times. If you know it F42, that's okay. But at times it's really difficult for us to recall. If you are in your second year or in your first year, right from this day onward, if you start remembering it, what will happen is like it gets imbibed in. It will be there in your reflexes. Even if someone asks you in your sleep, you'll be easily saying, okay, F31 is this one, F32 is for depression, F31 is for bipolar, schizophrenia F20, similarly 6 at 20 for schizophrenia. That is how it is. Don't keep these things for end. If you start practicing it from now onwards, you will never ever fail to recall or remember, and it won't be that effortful. What is happening is like at the end we try to have a lot of things to eat, but we can't chew that much. So that leads to indigestion. So bit by bit and in pieces, if you start learning these things, you'll be able to recall everything at the end. Because while taking your history also, no, this part, the clinical part, it will again come up. You will again open the book, you will again open your digital copy and you'll look. And ultimately, you'll be able to remember it. The diagnostic criteria as well as the codes. Fine. For child psychiatry specifically, I'm focusing on DSM 5. Rest, ICD 10 and 11 is good to go. So, substance also, ICD 11 is a very good book. Now, choose either of the three. Okay. This edition came this last year in 2024. This came in 23, and this was also there in 23 or 22. So this is the latest one. Okay, any book you can choose. B, there are people who want to go with two books also. You can go, but for rest of the chapters and things, you have to be you know you have to stick with one of them, be it Tasman, be it Oxford, be it Synopsis. So definitely I would request you to choose one of the um, out of these three. The best way is to read a single topic from each of them. If you are a kind of person who wants things to be in a very much organized manner, and you want things to be there in a proper format, that it has to be labeled like that, and then it has to be, and it should proceed in a particular way, I think then, but this is my way. If you can definitely take a look at all the three books. This is something which you can go for. If you want things to be a bit casual or a very not that elaborate, not that detailed way, you can go with Synopsis. And this lies somewhere in the middle, neither too lenient nor too strict kind of book, Oxford. So according to you, you can go with this. Information remains the same in every three book. Only the way it has been presented changes. So either of these three books you can go. This is the latest one, so all the updates have been included. This lacks a bit, but yeah, again, this is also a good book. Oxford is very good for those who are the English is pretty easy. The lines are pretty lucid. It's almost in a structure. So if someone is very, they feel that their English is not at all up to the mark, or they want something easy to read on. I'm not judging anyone, but still, if they want something easy to read on, this is one book that you can go with. Okay, for all the chapters which you feel, you can either stick to this Tasman, this one, or this synopsis. Okay. Now, once you are done with these three books, you have selected one book. Like, for example, I read this because this was a very old edition. Tasman was a very old edition at my time. I read this book. So, what happened? Like, I read the whole thing, except for a few chapters. At the end, I read the whole thing. Okay. But I also have to read some portions from this book because this is the big book and you have to read some portions from this book also. So if you're reading some portions from this book, like for example, if you're reading these portions from main CTP, then you don't need to read these parts from these three books. You can avoid it. If you want to read CTP, you can focus on these topics that I have mentioned. These are the headings or the broad chapters that has been mentioned. Reading Tasman for third year students. I'll answer your question at the end, Shravani. Don't worry. Okay. So, see, neurocognitive disorder, schizophrenia and other psychosis, mood disorder, dissociative, and part of neural sciences. These things can be read from CTP. Okay. If you still find that CTP is too heavy for you, too difficult for you to read, then you don't have to worry much. Go back to these three books and read completely. Read everything from these three books. You won't feel you won't feel that there is a bit of difference, and you won't miss on if you don't read CTP. If you read CTP, it's a good thing, but it is not something which is mandatory that you have to read it from cover to cover. I'll give you a list of important topics or the headings that you can read from CTP. Don't worry, but if you are reading, if you want a textbook, these three are good to go. If you are comfortable with these three, fine. If you can, take CTP, take these portions from CTP, okay, and then you're okay, good to go. If you can't do CTP, no issue. Shift all these portions to these books. Read it from them only. Okay. Now, coming to neuroanatomy. Neuroanatomy, these are the basic things that you should know in neuroanatomy. Again, this is a very good book. Latest one is also there. Seventh edition is also there in PDF. You can go through this book. So again, you have to have a diagram. This I have also mentioned in the exam preparatory module when we were discussing. You need to have a diagram, label it, and keep around 10 points ready. Why this organ is important for our brain, normal functioning, and role in psychiatry. Like for basal ganglia, we know that this is very important organ, part of brain, not that has implications in your Parkinson's. Also, you have implication in your movement disorder, OCD. Okay, even the role of basal ganglia has been seen in anxiety. So you have to know the basic functioning of that part, and also the role in psychiatry. Keep around 10 points ready. Okay, 5 for this, 5 for this. Make a diagram of your own, label it. Don't have to read this book also page to page. No, you have to just pick up your thing. See, you are not doing MBBS, you're doing a postgraduate residency, and it is something very different from MBBS. You have to have your clinical work in priority, and whatever time you're getting, you have to read in that time only. Nobody will give you extra time. So always remember that this is not MBBS. It is something very, very different. So always and always try to have a very selective approach. One notebook I asked you to make for your thesis. Remember, that was the first notebook that I asked you to make for thesis. The second notebook I'm asking you to make is now. Don't plan for long. 1 to 2 weeks kind of planning is good. Maximum 1 week planning should be there, not more than that. Take at least 4 topics a week. Now, skip that habit of reading through chapters. You won't be able to complete chapters in 1 or 2 hours, okay, or you won't be able to do it in even half an hour. So it's pointless to focus on chapter. Focus on topics. Suppose if I decide with five of you all to today we are going to read basal ganglia, will we know that basal ganglia has to be read, anatomy should be there, functioning should be there. Pick up Snell or pick up any of the book. This is a very good book. That is why I have placed the picture of Snell over here. Okay, take basal ganglia, read it. After you have done it, try to go to the Google or to any of the software, sorry, any of the website. Type simplified diagram of basal ganglia. Take a print of it, or if it good for you, you can draw it in your own notebook or any of the A4 sheet paper, and then keep it with five functioning and five role in psychiatry. Done. One topic you are able to do over. No need to keep on stretching it for like for 2 3 hours, 4 hours. If you are fine with it, that topic is done for the day. You can either keep a file if you're using A4 sheets. I have this habit of writing in A4 sheets, so I keep a file. Else, you can go with the notebook. Notebook approach is very good. First 50 pages should not be touched. Later on, you can write on those 50 pages, write every topic that you have done along with the date. At the end of your year, you will feel that you have done most of the reading, so you don't have to worry. Okay, second notebook is for your reading. Okay, plan maximum for a week or two, not more than that. If you do something more than that, you won't be able to fulfill it. Okay, so at 4 topics per week is good enough. If you can do more than that, it's fine, but 4 topics is something which is fair enough deal. Okay, suppose if you're studying Papez circuit today, we know that the basic component of circuit is amygdala, hippocampus, mammillary body, and cingulate gyrus. So we have to look for these important parts. Once we are done with the circuit, we should know the functioning, emotional response, the sexual part, how it is important in cognition, retrieval of memory, why it is important in memory because of the hippocampus, or and then we should know the role in psychiatry. Done. Maximum 2 to 3 pages, and this is what we can do. If you're reading, please that time you should read with full focus for 1 to 2 hour. If you have more time, good. Spare more time, then cover more topics. But this is how you should read a neuroanatomy topic. There are multiple options over there. People will say read netters, people will say read BDC, people will say read anything. You should know what is good for you. The best way is to keep it simple. Either download a like I have also included in the library. You can go to the library, the exclusive club library. You can download a article. It has an article on Papez circuit. Download it, read it, draw the diagram, write it in that article only. Done. It has everything. I have also included articles for basal ganglia, thalamus, limbic system, amygdala, reward circuit. All things have been there. So either you can go with this textbook, only selected specific topics, not read, don't read from cover to cover. Keep it in this manner: diagram, label, 10 points, 5 for functioning, 5 for role in psychiatry. You are good to go. You don't have to worry much. Okay. Now, coming to neurochemistry and neurotransmitters. Two things that you should know as a psychiatric resident is neurotransmitters and mitochondria. You should know every part of cell, but these are the two. This is one organelle that you should know. and this is something which you can't miss upon. A very good book is Lippincott. If you don't have it, I can like I've shared this PDF also, but if you find it, a hard copy of it, it's good. Neurotransmitters here has been given in a very systematized manner. While reading neurotransmitters, what you should know the region from where it is being released, not released, where synthesis is taking place. Pathways, where it acts, and then the functioning. 5 points on functioning, and if there is some kind of disturbance, you should know the implications in various disorder. This part is so important that while discussing with your third years or your final years, every time when we go through the uh, question paper which is there in your university, one question is there. One to two question can be there, but one question is definitely there from neurochemistry. Either you have to describe a neurotransmitter, either you have to write the whole pathway and implications in psychiatry. It can come as a long uh, you know long question also, that what are the criteria of a neurotransmitter, which how it is different from neuropeptides, and what are the various functioning of a particular neurotransmitter and its implication or role in psychiatric disorder. This is there. If you ask your final years and those who have passed their exam, you'll see that most of them will have this one question. You can't skip this. So keeping this book, and again, don't read biochemistry full. Only and only neurotransmitter synthesis you can read. You can read either like GABA, glutamate. You can read from this. It is optional. This is a very good book that actually summarizes everything. One thing I'll just tell later on. Hmm. From CTP, the main textbook, if you're reading, this book also gives a fair amount of things with neurotransmitter. That is why I have labeled here. These are the four chapters that you can read from CTP. Very well written. Okay. You can see the flowchart from this book, Lippincott. But if you want, a very detailed description of this has been written over here, along with implications and role in psychiatric disorder. Okay. That is why I've mentioned it. Neural sciences from, and these are those chapters, four chapters that you can read. You can skip others, but if you are someone who really wants to read neurotransmitters, you can read it from CTP. Okay, now we come to something important, that what are the chapters that you can actually read from CTP. If someone wants to read CTP, second year is a good enough time you can start reading. Please, this section is not for your final years. Okay, third years, please avoid this, not for them. This is very good option and a very good book for all those who are in your first and second year. And these are the chapters that you can focus on. Don't, again, don't have to cover it from very first page to the last page. Remember, you are not an MBBS student, you are doing your MD. You don't have to be a person who has to complete each and every book. You should know rather everything, a bit of everything, and you shouldn't master Lippincott, okay, or you shouldn't master Snell. You should know specific things, and then you have to move on. Okay, these are the important chapters that you can focus on. I have revised a few chapters. This is the second time I'm taking the orientation one. Like in 2023, I took orientation from majority of the colleges, but again, these are the chapters that you can focus on. Although if you see animal models, chronobiology, immune system, basics of sleep, appetite, epigenetics, I have added enough sufficient amount of articles in the paper one portion of your exam, okay, in your exclusive club central library. But this book is also good as far as these chapters are concerned. You can go and have a look at them. If someone is confused regarding where to quote the psychiatric interview, some of the definitions have been given in chapter number 7 that you can do. Rating scale has also been given, not more than that. It is done. Don't have this FOMO that if you're going to miss something from this book, that if you don't read from cover to cover, nobody can read from cover to cover. You have to read something very important that shouldn't be missed. That is why I'm giving you this list. Otherwise, there is no use of reading this book. Okay. If you start reading everything from cover to cover, you won't be able to complete it. Again, you will land up in hot waters because important stuff will always be missed. Then, neurocognitive disorder. You can read. These three topics have been mentioned nicely. If someone wants to read schizophrenia, they can read these things. But if you find this very difficult to read, again, you can switch to one of these three books which we have mentioned earlier. These three books, either from Tasman, this, or Synopsis. Tasman covers schizophrenia in a very good manner. Schizophrenia, this book covers nicely. Also, mood disorder. Child psychiatry, nice. It has been given nicely in Synopsis. Okay, it has a mix of everything. So, yeah, that is why the volume is less. The OTP, Oxford Textbook of Psychiatry. Okay, now let's move ahead. And if fine, if you want, you can read mood disorders also from here. Neurobiology and clinical features of anxiety disorder. OCD is not given well, neither in your in this book. So for OCD, that is why I have not included any topic of OCD here. See, factitious, dissociative, some psychosomatic components very nicely written. Suicide is something which you can read from CTP, and ethics in psychiatry. Now, for OCD, you can go to Tasman. You can read your synopsis for anxiety also. Or I think recently I shared a book called as Hollander. If you get time, these two chapters should be read from Tasman or synopsis. If you are a person who wants a wholesome approach, Hollander is a very good book. Hollander. Okay. OCD, anxiety, everything has been covered nicely in Hollander. Okay. Eric Hollander's book is good for OCD and anxiety. Now, don't read Hollander also from cover to cover. Only these two chapters. Once you are done, over. Keep that book. If you have, you are done with that book. You don't have to buy it. You don't have to keep it, like you don't have to read page to page. Okay. So CTP, if you read these topics, no, majority of your work has been done. You don't have to worry that if you're missing on a lot. This is something which is okay. Like you won't need much more. Now, this is where I want to focus on. Hmm. So this is something how to make notes. This is in that format in which you'll be writing your exam also. Like for example, if you're writing schizophrenia, you should know a bit of the definition which has been given in your textbook, the ICD code, epidemiology. So if you start making notes, make it in this order. Whatever notes has been circulated here and there, and whatever kind of PPT has been going on in circulation, they lack the systematization. If you start writing your things in this manner, what will happen is things will be there right in front of you. You can imagine, okay, whatever topic is there in my notebook, in my textbook, this is what I have to remember. If you start doing it, you'll be able to recall most of the things. Okay, like for example, if you write the definition, if you have written the ICD code that schizophrenia has been given in this or this in ICD 1011 under the rubric of or the broad heading, you should know. Done. This part is done. Epidemiology, I don't know why it also used to haunt me, but later on I found that it is very easy to remember epidemiology. Epidemiology, you can remember it from National Mental Health Survey, Indian data from National Mental Health Survey, and if you want Western data, you can go to World Mental Health Survey, Western data, or you can rely on CTP or Synopsis, what or even Tasman. Whatever data they are quoting, it is for the Western world. You don't have to remember the exact percentage, you have to remember something very close to that percentage. You mostly remember that in psychiatry 13 and 30. These two percentages are something where you'll find very, very common. 30% is something which is very, very, very common in psychiatry. If you go and have a look at everything, you'll realize that these kind of percentage is very, very common. You don't have to remember it like 13.22, okay, 20.22. Gross percentage is something which is required to be remembered. National Mental Health Survey, Indian data, a chart has been given to remember that chart. Whatever you're reading, try to write that thing in your next book, in your notebook, sorry. Okay. So either you can make a register or a notebook, or again, if you like, you can have a digital copy of it. No worry. Like, don't, it's upon your choice. And then the diagnostic criteria. Now, here it becomes very easy. If you have read uh, things from your ICD 11 and DSM 5 beforehand, you know the diagnostic criteria even before you have read the chapter. The clinical features and diagnostic criteria almost are the same. So, if you have read it beforehand, it becomes easy. You can definitely go on and literally glide through that part in that book. You don't have to focus much because see, diagnostic criteria, they are picking it up and putting it in a book called as ICD DSM. What these textbook are doing is like they're picking it again back and trying to explain it, expand it. Nothing more they are doing. So again, it is something which is easy if you have read everything beforehand and then we are going to a detailed version. See how DSM has been given. In DSM, a single criterion has been mentioned, and when you open the next page of it, you see that it has been described in a paragraph. That is why reading DSM 5 or ICD 11 gives you a very good snapshot view. Okay, that this is the content that I have to remember. Same thing will go in the textbook also. That is why reading ICD 11 and DSM 5 is important. Okay, this portion, neurobiology, this is very important. Not obviously not everything is something a joke. Everything is important, but neurobiology is something which is given exclusively as a separate portion in Tasman. A whole section has been given for neurobiology. If you open Tasman, right in this third, I think it is the third or the fourth unit where neurobiology of psychiatric disorder has been given. Every psychiatric disorder, schizophrenia, mood, bipolar, everything, anxiety, OCD, they have given a separate section of neurobiology, and then a separate chapter has been given for each one of them, each one of the disorder. So if you want to have a good idea about neurobiology, again, among these books, a separate section has been mentioned for neurobiology in this. Okay, here also neurobiology has been mentioned. Here also neurobiology has been mentioned. But a detailed and elaborate view has been given in Tasman, a separate section. Okay. In neurobiology, don't get lost. You should know, see, while studying neurobiology, you should know major 3 to 4 areas of the brain. Three to four neurotransmitters involved. Not three to four, only two maximum, like two or max three neurotransmitter involved. Changes in brain region that is evident on imaging. Like basal ganglia changes are pretty much evident in OCD. You can't miss on it. I have included one PPT and one presentation in the Central Library exclusive club one. Go through that also. That is also given. And the pathway, that is neurophysiology. How the pathways have been implicated in a particular disorder. Okay, so these are the neural pathways. Like basal ganglia has been implicated in OCD, so you should know the pathways of OCD and where it has been implicated, and you have to draw that whole thing. Okay, now once you are done with this differential diagnosis, keep three differential diagnosis, not more than that, and then the management plan. Here, something there is a catch. In management plan, you have to focus on guidelines. Indian guidelines and Western guidelines. Okay, this portion, I'll skip this part now for now and I'll just move on to this. This is the place where we'll be reading guidelines. For all disorder, you can follow the NICE or the IPS guideline. For mood disorder, there is one more thing that you need to add on, that is CANMAT. CANMAT guidelines needs to be studied extra. I have compiled this mood disorder guideline from seven different guidelines in a chapter, like in a single document. I'm doing it for psychosis also, so it will be there with you. Don't worry much about it. Everything has been provided to you. So for psychosis, I'm doing it. For mood disorder, already I have done. I have made one document. Also for gender dysphoria, read WPATH guidelines. Also included in your exclusive club central library a presentation on gender dysphoria, which includes the WPATH guidelines. Also for paraphilia, I have included that. For paraphilia, I have written one article and also I have shared the PPT, the treatment. Although very rarely asked, but if you are interested, you can read. For OCD, IPS guideline is something that you should read. If you have time, then read NICE. You won't find much of the things in NICE, except that clomipramine is the first line agent in NICE, not in IPS. And for drugs, you can read clozapine guidelines and mood stabilizer, how to use it, and this has been mentioned. Okay, this is the guideline that you have to focus on. Don't go for anything else. APA guideline, a very old guideline. Recently, what they launched was for bipolar, borderline personality disorder. What came in 2024-25. This was for this. For eating disorder, they have given, but they haven't updated there for mood disorder or for psychosis or major psychiatric disorder. So, reading NICE guideline, reading IPS. If your institute favors this Australian guideline and Australian and the New Zealand guideline, then you can read, but you don't have to worry much about it. These are the list that you have to go. So, while writing a note or while making a note, as far as management is concerned, in all the books, this has been mentioned because there is no, like, this is the book, this has been mentioned well in your textbook. For Indian, you can go for IPS guidelines. If you read the Western guidelines and then you read Indian guideline, you'll find that IPS guideline is just nothing but a copy paste of the Western guidelines. 5 or 10 Western guidelines they have taken and copy pasted it and formed a CPG. But Since you have to give your exams in India, you have to know how it has been presented in CPG. That is the guideline that you have to remember. Okay. And while discussing guideline, always remember non-pharmacological thing has to be mentioned. You can miss on anything, you can't miss on non-pharmacological management. Fine. This goes for everything, be it for psychosis, be it for OCD, be it for anxiety, GAD, panic, whatever you are trying to read, try to make note in this format. You will never ever forget. Okay, if you read ICD DSM first, differential diagnosis will become very easy because it has already been mentioned as a differentials in the ICD and DSM. So this point won't be a big issue for you. Management is already provided in your guidelines. You can skip this in your textbook. Rather, you can jump on directly into the guidelines. So this part also becomes easy. Only for this and this, you have to read your textbook. So see, multiple things are being taken care by other sources. So reading a textbook right from first page to last page is just a very old fashioned kind of thinking that we are having. Okay, you just have to complete a particular topic, a particular thing. You don't have to complete a chapter. Nobody is going to ask you whether you have whether you have read a full chapter from Tasman or Synopsis or CTP. You just have to know a topic with authentic reference and a source. Fine. Uh, PV, can you mute yourself? Fine. Now, let's go to Maudsley. This is another book that you should focus on. Maudsley textbook. Now, here it is the guidelines have been mentioned. Again, I am summarizing it. Nice guidelines has been given for schizophrenia. If you go and read from this, done. For LAI, good book. Clozapine, that is also a good book. Here, lithium valproate, carbamazepine, there is a table. These are tables that has been given. Don't need to read the full text. If you have time, read the full text, but the bare minimum is right. Read the tables of lithium, valproate, and carbamazepine. Okay. Focus on the tables. They have also mentioned the flowcharts for these topics. If you know this, done. This is also mentioned in form of table and flowchart. Nothing more. This we have covered already, no? TRD. And this is also we have covered. Okay. It has also been mentioned in form of table the withdrawal symptoms, and switching antipsychotics is also given in form of table. If you have time, you can read the portions from the text, but if you don't have time, read it from the table. Okay. Same goes for everything. Here we have this is also mentioned over there. Only read the relevant drugs that you use in your OPD and in your ward. Don't try to read every drug. Here also remember the relevant drug list only. You don't have to remember everything. It has been given in this chapter. This you have to read full. Very good. It has nicely been presented. BPSD or behavioral and psychological symptoms from dementia. Read full. This also has to be read fully from this book. Okay. Now, one thing coming to child psychiatry portion. Mhm. The child psychiatry portion, the CPG IPS guidelines of child psychiatry is a good source because it amalgamates your theory plus assessment plus the disability part. Also, it gives a very good information regarding non-pharmac treatment. Okay, that is why I am saying that for child psychiatry, read CPG IPS guidelines, child psychiatry part plus DSM 5. Okay, once you are done, then you have synopsis. If you want, you can read Rutter. Rutter is again a big book. You can avoid it. Synopsis is something which you can read. Child psychiatry has been nicely mentioned in synopsis. Better than Tasman. Better than Tasman. Yeah. Although Tasman is not bad, Oxford is not bad, synopsis is a way better as far as child psychiatry is concerned. For only for child psychiatry. Yeah. But before reading anything, read the CPG guideline. Like if for intellectual disability, you can download it. You can read the full text. You can write it there in the article itself, and then you can proceed with the DSM 5. What will happen? You won't take much more time. You won't invest more time in reading from DSM 5 or ICD 11 because it has already been covered in your CPG guideline. Because it covers everything. Whatever is being left will be taken care by your synopsis. Excuse me. Yeah. So don't create a fuss of child psychiatry. The portion is pretty less, but if it is to be covered, you can cover it with CPG guidelines and your synopsis. Okay. Let's come to some of the other topics. CL Psychiatry, this is a book. I have uploaded it and shared it also multiple times. If you want, I can share it again. Models of CL Psychiatry, Transplant and Palliative Care. These three things can be read from this. From Lovinson, you can read opioid, alcohol, tobacco. If you don't want to read Lovinson, if you find it too big, no issue. You can switch to Ames Blue Book. Or excuse me, or you can read from synopsis. Hmm. So we have covered adult psychiatry, child psychiatry. Now we'll come into community and forensic. Addiction part we have done, guidelines also done, CL psychiatry. So we are left with neuropsychiatry, forensic psychiatry, and community psychiatry. See, community psychiatry, these are the two books that you can go. Again, don't read it from chapter to chapter. These are the important things that has been mentioned and it comes in your final year exam also. This is not an arbitrary kind of thing that I have made. I have reviewed multiple question papers through various universities that has been shared by the residents only. And then I have formed a very common kind of list. This is what you can read from BS Chavan sir books. This is what this you won't find it in PDF. You have to buy it. I think one of you can buy it and share it, like you all of among your batchmates also. And this already I have uploaded in your central library. This booklet of community psychiatry by Nimans. Okay, you can look into any of these things, and these are the topics that you need to cover. Again, while covering community psychiatry, try to make brief notes. Don't make detailed, elaborate notes. Make very brief notes. Fine. And when you are doing it, when you're reading this book is very easy to read. If you're reading some, like for example, if you're reading stigma, stigma is a very common topic that has been asked in questions in Viva also. It covers stigma in around 5 to 10 pages. But if you read stigma from here, you won't have to read it from anywhere else. This book is a very wholesome book. Okay, similarly for homelessness and mental illness, there also it will be covered in community psychiatry. Okay, fine. Like in this book only, they cover homelessness in a nice manner. Coming to the important trials, this is the list. I have shared it previously also. I'm again sharing it. Brief findings of each of this trial has been included in one of the document which I have shared. This is something which you should focus. Don't read everything about trials. You should know only these six things about a trial. Only these six things. If you know these six things, what happened in, for example, if I what I was asked in my viva was this: embolden, bolder, step BD. What was the relationship between these three trials? Just a minute, I'll bring my charger and I'll start. Just 1 minute. Yes, fine. So only you have to know a year, the location where it was conducted. Although I have shared drugs used in bipolar disorder. Okay, so they have asked these three things, but they don't want everything to be answered. They just want to know whether you know a gist of it or not. What were the findings? Rather than the percentage, they were interested in findings. The drugs that has been tried and the trial has been done. Similarly, when discussing child psychiatry portion, one of the examiner, sir asked Tordia trial from me and Potts trial. Okay, I have shared that document in which it covers all things in brief. Tordia was there for treatment resistant depression in child, and POTS were for OCD in child. Just have to know the finding that sertraline was a good enough drug that was found in POTS. CBT plus sertraline was more effective as compared to sertraline alone or CBT alone compared to placebo. In Tordia, SNRI were found to be more effective. Specifically, venlafaxine was found to be more effective than SSRI. So these were the findings. You just have to know the findings. That is why I've shared this document. Don't have to worry about reading everything. If you want to read everything about a trial, these are the three trials that you can read: KT, Cutlass, Stardy. Full, if you want, you can read this. Okay. Coming to laws, again, laws in psychiatry, in for forensic psychiatry and laws, these actually you can read from a single book. Either you can read it from Nimhan's manual that has been given there, Nimhan's manual in forensic psychiatry. Although we are coming up with a lecture series on forensic psychiatry also, but I would encourage you to read forensic psychiatry, or there is a forensic psychiatry book by Jiloha and by Nambi. Jiloha was a much updated book, so you can read that also. These are the important things. You don't have to read everything again. Important laws. If you ask me four laws, that is important. Four laws. This, sorry, not CODPA. This is RPWD. You can't miss on these four. Rest, you know, you should know everything like what has been mentioned, but these four laws you can't miss on. Important clause and sections, that's it, and punishment. So, in these laws, what you have to remember is the section where it has been described. The punishment has been, the law has been described, where remember the sections where it has been, where the punishment has been described. What is the number of years that the, okay, so description of a particular act, remember the section. Description of the punishment, remember the section. So the act and the punishment has to be remembered. Only the important ones which you feel important should be remembered. Not everything has to be read in the laws also. Like if you read and download the Gazette has like it covers everything, but you have to remember important points only, not everything. So that is why reading this becomes very crucial. Act, like for example, a rape has been conducted to a minor. You should know how, what constitute rape, what constitute minor. That is one section which has been allocated in POXO. Another section describes the punishment of that act. You should know that section also, and how much year for that person will be jailed, and what is the fine that has to be there. You can. This is what is required, not more than that. Okay. If you are thinking that forensic psychiatry is too much in MD, these four topics, five topics, that done, nothing more. Okay, important studies in psychiatry. This you don't have to read it separately. While reading your major things in your textbook, I have also shared my seminar on this. So this will be covered in your psychosis. This will be covered in your PPAD, STAR D, and STEP BD is also covered in this. This is for your epidemiology, and this is for your substance epidemiology. Included them all of them has been included in the library, so you don't have to worry. You just go there, download it, and you can read. Or if you want, I have given a small kind of in my seminar also I've included most of them, so yeah, that is also there. Read fact sheet for this also. Fact sheet is being provided here also. Fact sheet has been provided. This also fact sheet, I'll share the fact sheets with you in the WhatsApp group and upload it subsequently, so that you don't have to go to the entire document. Read the fact sheet, and the important percentage and important data has been mentioned in the fact sheet. Okay. Now coming to the neuropsychiatry portion. See, individually I'm uploading these topics, but if you want, you can read from Lishman. But don't panic. Read only these topics only, 5 to 6 topics from this book. This book also covers fair amount of neuropsychiatric manifestation. Neuropsychiatry portion is missing from synopsis. So that is a book in which you will find a bit of disappointment as far as neuropsychiatry is concerned. Okay, neuropsychiatry portion is being missing in synopsis. Okay, and as far as Tasman is covered concerned, it also covers it. Okay, so yeah, that is something on a very like the Tasman covers the CL portion, this consultation license portion, and neuropsychiatric portion also. So that is also a add-on point for Tasman. But in synopsis, this part is missing. So you have to look into Lishman or Oxford or Tasman for this. Although one thing I would like to say, Lishman is an old book now, so delirium dementia management might not be up to date. So you can definitely look for a neuro. There is a book that has been launched by APA, Neuropsychiatry. I'll share it with you. You can, but don't read the again. You don't have to be a master of this book. You have to read only these topics: epilepsy, TBI, Parkinson, HIV, steroids. Delirium dementia has already been covered in CTP, so you can avoid these topics. You should know. Again, the modality of making the notes is the same. Clinical features, neurobiology, management, diagnosis, done. Okay, now this is something which I would like you all to keep. All the important IPS CPG guidelines, specifically for child is psychiatry. Coming to psychology, you can choose any of the book. This is more exam focused. Morgan King is a book which is made up of notes. This is more towards exam. Baron is a good book. I have shared some psychiatry book also, but this is a even way better book, Wayne Wheaton. If you read multiple example and multiple figures has been mentioned, it's not a boring book at all. These two books, these are not at all boring. Okay. So if you read this, what will happen is like you'll be able to figure it out, you'll be able to picture it out. So examples have also been mentioned over there. So you will be able to get a real kind of example for like for example, if you're reading this part only, learning theories. So multiple live like the real case scenarios has been mentioned, which you can read, and like you can also quote these kind of examples while you're writing the exams also, so that you don't have to mug up a lot. Okay, that is what I want you to keep this in your mind, that you can choose any of this book. You can choose Morgan King also, but Morgan and King is a very, it's book that has been written for exam purpose only. You can also choose Atkinson's and Hilgard. This is also a book that is having same kind of book like this. Okay, you can also you can also choose Sicarelli. uh, Already shared with you, I'll share it again. mm, Sicarelli and White. Yeah, this is another book that you can go choose one book, either Atkinson, Sicarelli and White, or Wayne Wheaton. One book, that is sufficient. You can go with Barron also, but this is a very different kind of book for exam purpose. If you're having an exam, this book is something which you can actually go through, but a bit boring because it is having black and white pictures and all. No pictures are there, black and white thing is mentioned. These books are colorful. Okay, these are the important things that you need to learn in your psychology. Again, I have prepared only those chapters which has been asked in your exams. So nothing more, nothing less. Important points have only been mentioned, so that you get a hold of what you need to read. Remember, again, I'm emphasizing again and again, you have to read topics, not chapters. Once you're done with your topics, you have done your reading part. Coming to therapy, see, there are multiple books. One is Woolberg. Woolberg is a hefty book, but definition of psychotherapy. What do you mean by psychotherapy? The definition has to be read from this book only, Woolberg. If you want, I'll share the definition with you. If you want to learn therapy for specific disorder, I would say you can learn it for OCD, anxiety, phobia, depression, and sexual disorder. Okay, people do ask therapy for sexual disorder, and it does work in real world also, because many a time it is not that neurobiological. That is more a kind of interaction between two individuals that is causing problem in sex. Okay, for OCD, it has been given well in Hollander. For anxiety, phobia, depression, and sexual disorder, you can follow this book. Although I have shared it, this is Keith Houghton. Nicely and lucidly written. CBT for anxiety, phobia, depression, sexual disorder, all has been mentioned nicely. If someone wants to read, they can read CBT specifically from this book by Beck. Daughter of Aaron Beck has written this book. Okay, you can read this also. But for therapy portion, you should read OCD, like Hollander. ERP has been nicely described. If you want CBT, again for OCD, you can go to Keith Horton also. Keith Horton is a book that has been specifically written for, you know, for MD residents. Very nicely, it has been mentioned all the practical points, how to maintain the therapeutic relationship, the alliance, how to proceed with one step to another, and whether these steps should can be, you know, you can cross a particular step and jump to the next step. Everything has been mentioned nicely, and the best part is it has been like a case description has been given, so that you don't feel that you're reading the theory part only. A case description has been given, and how therapy was involved and incorporated in that particular case, that has also been mentioned in Keith Horton. So Horton is something which is a good book, you can, as far as therapy is concerned. Okay, biostats, I have included this in all the important articles I have included. Also, we'll be covering important things in our discussions to go in exclusive club. So don't worry about biostats as of now. ठीक है, biostats अभी बाद में रख दो, पहले ये सब कर लो. Do it, do all these things now, and then we can go with the biostats. Big thing, uh, something which I would like you to think about: seizure, stroke, Parkinson. You can't miss on it. CTP doesn't do justice, nor any psychiatry book does justice to these points. That's why I've included these three books. Best is to go with Harrison, you all know. You have read it also. Three chapters from Harrison won't do any harm to you. Or three chapters from Bradley, or any of the three chapters from Adam and Victor. So these are all good, nicely written book. Bradley and Harrison is more student friendly, more lucidly written. Although individual preference is there. These three topics you can read again in the same manner: description, epidemiology, clinical feature, differential diagnosis, the assessment part, and then we'll go with the management. The same manner you have to write. Don't have to worry much. The same pattern will follow. Okay. And pharmacology. Now you are in your second year and your third year. Try to read at least some of the important drugs: valproate, lithium, carbamazepine, lamotrigine, risperidone, olanzapine, quetiapine, clozapine, venlafaxine, trazodone, fluvoxamine, and TCA. If you want, you can read these things from this book, already shared with you. Now, how to utilize Instagram page? This is the Instagram page that is there for you all. Go to the Instagram page, go to the bottommost portion of the Instagram page. The first unit that I have covered here is psychosis from CTP. There are around 30 posts of psychosis. Next is mood disorder from CTP, around 30 to 35 posts. After that, I've covered OCD, around 15, around 25 posts for OCD. All has been covered in sequence. If you are feeling not, if you don't feel like reading, if you don't feel like doing anything, if you don't get time, also you can go to the Instagram page. You can save that post, or you can take a screenshot of it, read it. Okay, so that it won't be any burden to you. If you have done nothing for a single day, go to that Instagram page, go to the bottommost portion. Like there are around 456, 465 posts. But the first 30 posts deals with psychosis. Next 30 to 35 posts deals with mood disorder. Next with OCD. Sim- Subsequently, theme has been made. Okay. Okay, I'm trying to make a blog page out of it. So yeah, but as of now, Instagram page is something which you can go if you have done nothing for the day. You can spend around 5 to 10 minutes while reading that slide also. That is why it is helpful. In the last minute revision also, it is very helpful. You can go scroll 5 minutes to 10 minutes. You're done. That is the use of Instagram page. Okay. Yes, don't panic. Learning is a stepwise active process. Time to relax should be there, and yeah, residency brings a new thing. It will change your outlook. Okay. That is how you should do. So as of now, To summarize, I'll say go with your thesis, 8 months for sample collection, 4 months for writing, keep one notebook for reading, go topic wise, chapter wise is a big no. Make notes, your own notes. Don't read the stale, old, circulated notes. They are nothing but a piece of crap. Make your own note by reading from specific books and with reference. If you have even a single line written by any one of you with a reference, anyone would like to read that line or a paragraph because that has been referenced and it has been prepared by you all. That is the impact of making things uh, authentic. If it is there, you have kept a reference, if you have written from where it has been taken, it becomes so authentic that people will you will yourself start believing in your notes. Okay, so don't go for anything else. You have things in your hand, nobody is stopping you to read and nobody is stopping you to prepare your notes. Notes making is an art which we have discussed, that what are the important points that we have to write. Don't write everything what is there in the chapter, that is not important, then the purpose of note making fails. That is why I have kept only the specific portions that is needed for a particular topic. You don't have to write everything what is written there in your uh, in the textbook. Make notes either digitally or through your pen paper method. That is why you need the second notebook here. Go to your ward and to your OPD. If you find something interesting, add on to these notebooks. The last 50 pages should be there, in which you can make important observation that you have done in your ward and your OPD. Some clinical pearls, some important things that is being taught. Fine. Keep guidelines with you. CPG is a must for child psychiatry. Other guidelines I have also mentioned, but specific focus should be given to child psychiatry. If you want to read child psychiatry, Synopsis is a good book. Another thing, keep around 4 topics per week to be read. Plan should be there for 1 to 2 weeks. If you have to go for a vacation the next week, don't plan anything on for that week. Come back after the vacation, then you will plan. Okay, you don't have to fit in few things, like even when before going to vacation I have to read. No, no, no. Keep things light, keep things simple. The only thing is you have to be there doing things. You shouldn't see, you have to relax, but you have to keep certain amount of your time so that you can read. And that is why I think this is the minimum that you can do a week. 4 topics a week. Make notes. Why I'm emphasizing so much? Because if you don't make notes, it will go away from your mind. If you are making notes, it will stay there for a pretty long period of time. Also, if you're reading an article, at the end of the article attach 2 A4 sheets and stick the notes along with the article and keep that article with you so that it doesn't get lost. And also, when you read that article, if you're reading that article for revision, notes will be there with you. Okay. In your second year, plan out, because if you do around 60 to 70% of reading in this year, You will only have 30% left for the final year, and the 30% will be a cakewalk. Second year, you should focus on your adult psychiatry, child psychiatry, substance, and laws. In your final year, you can do the rest part. That is forensic, CL psychiatry, and also a bit of psychology. Some portions of psychology you can do here, you can do here also. Biostats, you can focus here, and this part. Neurology, hmm. Therapy, again, it is an overlap kind of thing. You can read here also, you can read here also. You can read neurology in your third year, or in your neurology posting, you can read. Okay. Likewise for ECT, you can read here only, uh, as far as your posting is there. Okay. So that third year becomes pretty less crowded. Most of the things will be covered in your second year, be it anything. Okay, neuropsychiatry again can be learned in your final year also. And yeah, these trials go in hand. Community and neuropsychiatry again in final year. You can go. That's right here only. Community and neuropsych. So see, major chunk is this. If you complete it here, you don't have to worry much in your third year. Okay, this is what I want you to like. This is just an outline that you can follow. Anyone having any question? Now it's the time when we should take questions. It has already been 2 hours. You can switch on your mic, your phone. Thank you so much, sir. It helps a lot. Shravani, reading Tasman for third year student suggestible. Can a third year student follow the second year plan? See, Shravani, you have messaged me in my DM. You're having your exams in September. Anyone who is having your exams in September, I would recommend them that stick to the plan that has been there given for the third year students. If you want, you can read a portion which you find that you are not lacking, you're not that much confident. Like suppose if you feel that if your therapy part is not good, you can go to Keith Horton and read that part. If you find that your child psychiatry part is not there, you can go to synopsis and read that part. Then it becomes easy. Don't try to cover everything that has been mentioned today for second years. Try to incorporate only those parts which you feel that you are lacking, specifically lacking that uh, confidence. Then only you can go and look to the specific books that is that has been recommended for the second year. Rest, stick to the plan. For Tasman, yeah, Tasman again you can read, but only specific portion. If you ask me, there are four things that I would advise you to read: psychosis, mood disorder, anxiety, and uh, a bit of dissociative disorder from Tasman. Not more than that. I think you'll be like you have enough of your readings from whatever you are doing as of now, be it from synopsis or from other sources. I've not discussed exam preparatory thing in second year because that is not required as of now. Fine. Any other question? Akriti Khajuria. Very informative video, sir. Thank you. Where to find videos of session that you have already taken? I think I have shared all the link of the videos that have already taken in your email. If you haven't received, I'll share it with you. Past videos are there in YouTube. I'll share it with you again. I have shared a bit also in I think today I can just DM me your email ID. I'll share you everything. Okay. Now, any more questions, Shravani? Thank you. Thank you. Anything specific that you want to ask? How to sharpen history taking skill? See, that is why we conduct history taking or case discussion thing. That is why we do it on frequent basis. Like now, in the coming week, we have two more history, frontal lobe, and those part. Try to focus on writing something like, for example, we have discussed this when we were discussing BPAD history also. That time we discussed how to express decreased need for sleep, decreased need for over talking, okay, uh, eating more food, overspending, grandiosity. All these topics have been discussed. If you want to sharpen your history taking skill, I would suggest one book. If you have time, if you have time, read Karl Arts. I'll think message me in the yeah, YouTube in the group. I'll share this Karl Arts book. Othmar is again a good book, but it is a bit bulky. This is a good book, Karl Art. Okay, Niyati, mention it in the group. I'll share it. Parul, thank you, sir. You have given me a goal and motivation to start working. Yes, you all keep me motivated. I am also a very lazy person, but uh, as with you, also, I have been studying a lot. Being studying consistently due to your classes, sir. Amal, thank you for motivating classes. Okay, thank you. Thank you, Amal. Fine. Any further question that you want to ask regarding planning, strategy, anything that you want? Because this is an outline that I've given. Most of the work you have to do. In the whole year, I would cover most of the portions that we have discussed, what I am going to, uh, like, whatever you have to cover. But in the exclusive club, we'll take these topics every month. We'll keep a kind of theme like the next because all of you have said much about the neurobiology and the neurotransmitters, so in the March we'll keep case discussions also, but the discussions would also revolve around the neurotransmitters and neurophysiology. Okay, neuroanatomy portions I'll also take, so don't worry about it. Ha, anything else? Don't feel shy to ask anything. Even if you consider it silly, it is important. You should ask. Nobody uh, at this stage, nothing is silly. If you are able to clear it now, you won't have to face that kind of difficult. How to utilize multiple articles you share on single topic. See, Niyati, if you say that if you have to read the multiple articles, that is why if I share after a discussion, you can either what you can do is like most of the students what they have said to me is like they actually copy the discussions that we do and they take a printout of it, and in that they put the articles list. If you have to read the articles, remember whatever articles I share do have a table, they have a diagram, and if you say ask me how to utilize multiple articles, you can either write the discussions that we do on WhatsApp, whatever discussions that we do, or whatever note that we do in our EC live session. After that, what you can do is like you can uh, incorporate those tables. You can print the table, you can print the pictures, and in the articles, you can read three things. The first thing is you can read if it is if it is a review article, you can read the topic that has been discussed. Important one is the discussion, okay, or the conclusion. This part should be read in whatever article I do share. Also, one more important thing that you should read is any kind of treatment method or management method that has been mentioned in that article. Not everything. You can go through these either the discussion conclusion part, the treatment and management part. and table and pictures. These are the three things that you should listen, that you can actually go and have a look in all the articles that I share. Any reference on how to apply scales such as mini plus? Okay, that's a different thing as of now. Mini kid, mini plus, these are scales that are used in your thesis. So separate kind of manual has been provided, but I think it is paid version now. Okay, you have to ask the author, but I'll look for it. You can download it from the net also. Okay, they do provide it. Anything else that you want to ask anyone, or shall we end the session? Or anything? Okay, Amal, Dipali, Dipai, Akriti, Niyati, Parul, Sachi, Shreya, Shravani. Anyone? Anyone would like anything you would like to ask? See, how to go about deciding topic of thesis. The truth is that ultimately, whatever your chief guide will decide, you have to follow that. But if they have asked to go and look for the topic, they must have given you some 3 to 4 topics that are their favorite in which they want to work. Suppose they have given you a topic of BPAD and you need to find a topic about it. Ask your seniors if they are working on any kind of BPAD kind of thesis. Ask your seniors. Ask about what kind of topics the faculty wants to do. Okay, the interest. And once you are done with that, if you have come across like he or she wants to do BPAD and wants to see the prevalence of sexual disorder in BPAD, or more a prevalence kind of study, then you can do the reading from a textbook and then go to the PubMed and type this BPAD in advanced search. Once you are done, what you can do is you can get a whole list of everything. Last 5 years, you should focus on what they are, what the research is going on. You can set the bar for 5 years. In advanced search, write BPAD. You will get the latest updates about whatever topics that has been written in last 5 years. And then accordingly, you can plan. Try utilizing PubMed. Look in the advanced search, select title. Okay, I'll make it clear. PubMed, advanced search. In advanced search, select title. Under title, write the title in which you want to work. Once the result is there, select the findings up to 5 years. And then most of the topics will come. Okay. This is how you can actually look for some kind of topics that is ongoing floating around in current scenario. Okay. Anything else or shall I end the session? Okay. Thank you so much. Thank you. Okay, Deepai. Thank you. Okay, sir. Anything else that you all want to ask or shall I wrap up the session? Fine. I think there are no more questions. We can end the session. Okay. Thank you all for attending and I hope it will be helpful for you. Do utilize this. I have shared it with you. I'll share this annotated one also with you and the recording will be shared to you by midnight. Okay. We'll meet again on the upcoming week with 2 cases and yeah, Shreya, Basu. Thank you, boss. Okay. Boss is fine. It's okay. It's okay. Nice. Thank you. Thank you, Shreya. Thank you everyone for attending the session. I hope it would be like it will do something. It will help you out. Okay. Thank you, Niyati. Okay. Bye.